as groups, individuals and organizations make efforts to support government in tackling COVID-19. I have joining me at this time Secretary General of the Nigerian Red Cross, Abubakar Kende. Earlier, I was asking you how the Nigerian Red Cross is responding to this pandemic.
Thank you very much for having me. As you may be aware, early in February this year, the Nigerian Society conducted a press briefing, particularly on Lassa fever that was ravaging our communities. Also at the same period, we emphasized and call for support from all and sundry in contributing to government effort on the prevention of COVID-19 in Nigeria. So for this reason, since the report of this case in Lagos, the Nigerian Society has further alerted its team of volunteers across the country in all the 36 states and FCT to raise up to the challenge in assisting our fellow Nigerians with the key areas on sensitization, or what we call risk communication and community engagement for the prevention and control of coronavirus. We have also worked closely with the government agencies on promotion of hygiene and health education. We are also working closely with the NCDC, especially in the risk communication, but also in the contact tracing and active surveillance. We have also rolled out plan working closely with the National Emergency Management Agency for mass care, provision of ambulance services, and other humanitarian support to the victims and relations of COVID-19. We are still intensifying efforts and working across all the 36 states with our branches and divisions in the local government areas to support the prevention of COVID-19 across the country.
All right, Mr. Kende, let's talk about these volunteers, 1 million of them. Are you getting a favorable response from them?
I must say that we have a very high turnout of these volunteers. In essence, if we had enough resources, we can mobilize more than 1 million. There are so many Nigerians that are interested and have commitment to support their fellow Nigerians in terms of prevention and control of this virus. So, but because of the limited resources we have to mobilize those that we have resources to support in terms of transportation, training, education, and also providing the necessary protective gears that will enhance their work to support the government efforts.
Now, for these volunteers, is there,
many people that are interested.
Mr. Kende, if you can hear me, for these volunteers, are there any plans for some form of welfare for them? Should they, in the course of offering their services for free, get some form of relief for their families?
Well, as for the volunteers, their job actually does not attract any fee or payment. However, they have been given training on the skills that they require on the specific area of intervention. They're the ones that are doing contact tracing, so they are trained on using the thermometer. They are given the basic equipment, protective personal equipment that will make them safe and secure during the operation. Those that are also conducting risk communications, they have also been trained on IPC and of course also community communications and advocacy and sensitization so that they can actually enhance their job. So we have the obligation of ensuring that their welfare is taken care of during their the operations. In addition, we also have the responsibility to ensure that they also have some insurance in case of any eventuality. But definitely, they are given the required training that will enable them to participate, to contribute to this task.
Abubakar Kinde, Secretary General of the Nigerian Red Cross Society, thank you for speaking to us on TVC News at 7.